Imagine a city where the power grid fails. Grocery stores go empty and trash piles up. This is what happens inside your body during shock.
Before we get too carried away, let's pause for a moment to understand what's happening at the cellular level in our daily lives. Okay, so let's start with a simple cell, complete with all its essential parts. Our cells need food and air to survive, which the blood provides through the circulatory system. The cells take in this food, create energy from it, and then get rid of waste products, which are easily removed from the body. Shock occurs when two things happen at the same time. The circulation system can't meet the cell's nutritional needs, and it also can't remove the metabolic waste products. In simpler terms, our cells aren't getting enough food and air from the circulation, and they're also struggling to get rid of their waste. So, will our cells die right away because they're out of food and air? The answer is no. Our cells are smart enough to have their own food reserves, but what about air? Cells don't have air reserves. So, our smart cell makes some SOS changes in their mechanisms to adapt to this lack of air situation, also known as anaerobic respiration. In this, cell transform this food reserve into a usable form, which then helps generate energy and remove waste and byproducts. But this adaptation comes with a cost. We've seen that normally, cells make a lot of energy and throw away their waste and byproducts easily through aerobic respiration, but in this adapted mechanism, anaerobic respiration, the cell's efficiency decreases, along with its waste and byproducts, which are more harmful to the body. If this continues, the byproducts, lactic acid, accumulate, spreads through circulatory system, which can cause systemic metabolic acidosis. Eventually, our cells' reserves are exhausted, and the SOS adopted mechanism, anaerobic respiration, also fails, and the cell can't generate any energy at all. Now, the real trouble begins because this loss of energy causes the failure of the sodium-potassium pump on the cell membrane, which requires energy to operate. This is sensed by the intracellular lysosomes, also known as suicide bags. They sense that our exhausted cell is unable to generate any energy, so our time has come. The lysosomes gets activated and release digestive enzymes, and cell death, or cell lysis, starts. This cell death causes the release of intracellular components, mainly potassium, into the bloodstream, which causes hyperkalemia. When your cells undergo these changes, your body notices and responds to them at the microvascular level, which we'll explore in the next part. Like, share and subscribe Surgeons MedEd for more. I am Dr. Pranil, from Surgeons MedEd, where visuals meet clinical clarity.